moving on to next topic, that is screens, streets and steps shaping activity patterns in kids and teens. That's a very interesting topic, and to deliver the talk we have the very eminent speaker, Dr. Ranjani Harish. She is the Senior Scientist, Head Department of Preventive and Digital Health Research, Madras Diabetes Research Foundation and Dr. Mohan's Diabetes Specialty Center. She is an enthusiastic researcher. She has got a number of publications, national and international, also a reviewer of several national and international journals, and also World Diabetes Congress. We welcome you, ma'am, to deliver this speech.
Thank you. Good afternoon, everybody. And I think ma'am gave me a very nice prelude to my talk, because mine is all about built environment and physical activity. So let's move on directly. I'm representing Dr. Mohan's Diabetes Specialty Center and Madras Diabetes Research Foundation here. I work primarily in preventive and digital health research. My last 15 years is basically I do a lot of field community-based studies, which is in the school, colleges, in the real, we do real-world experiments in the corporates, and so whatever prevention, we take it to the field. I have no disclosure, but I do have some data which I will be showing, which is not yet published. So again, the title is nothing of it is all, I think it's a lot of AI help, but the title, it was very catchy and I liked it. So I kept that title, and I'll be talking about the screen, streets and the steps, and then we'll just get them all together. So why does this matter? Why do kids matter? Basically, 31% of our population is basically below 18 years of age. And we already had the previous speakers, and I'm sure we have a lot of other parallel sessions talking about the alarming trends in adolescents, in young adults, about NCDs, whether mental health issues, and of course the biggest thing over there that we keep talking about nowadays is physical inactivity. Now, understanding the interplay of environment, the physical activity and how it relates to your overall health becomes very, very important. And in this, one of the biggest, the word trending, when you say itself, what do you think of is screen, right? So I will be focusing a bit on one of the first studies, and it's from us, from India, that we are going to be talking about how that screen time actually relates to physical inactivity and metabolic health. So the conference title itself, Weight Matters, and in children, fortunately or unfortunately, BMI still holds. That is the guideline still. Though we do have waist, we do have body fat. Please remember, as an epidemiologist, as a public health specialist, I am not a doctor. I am a public health nutritionist by training, and with further training in epidemiology and public health. I would say that there are a lot of standards, guidelines for WHO. You have IOTF. But if you're looking at Indian children, please refer to the Indian standards, which is published by Indian Pediatrics of Academic, because I see a lot of pediatricians using that till age 6, right? You use growth charts, but then you have from 6 to 18, and it includes epidemiological studies, which has been included in that data, and that's how those standards have come. It's from Kadilkar and our group and all of us together who have come up with these standards, and that should be actually a norm in anyone who's treating children and adolescents. It's unfortunate if you're going to be using WHO or IOTF standards and to diagnose our children with BMI, because they do not include our children when they're taking those guidelines. So please refer to Indian standards, which are validated and standardized. So we do know this is a big pressing issue globally, and it's known in upper income countries. You go to the Caucasian population, obviously childhood obesity is known. But for a country like India, where we are still having the paradox of malnutrition, which covers undernutrition as well as overnutrition, but the alarming trends in urban and peri-urban areas of adolescent obesity and childhood obesity is not even funny. It's just raging numbers, due to which type 2 diabetes is very commonly now seen in young children. I've just quoted 2 of our studies where we're just looking at trends, and as I said, when you use different classification, you'll get different prevalences. So if you see IOTF, which did not include Indian population at all in their thing, automatically our classification goes down. When you have WHO did not have India, they actually had Hong Kong Kong as part of their population for South Asians when they came up with their guidelines. And then they modified, and they had like 4,000 children from India just scattered, which were included when they came up with their Z-scores. So be wary when you use these standards to diagnose your children for obesity. When we looked up with our own data, we started studying in India, North, South, and things like that. We also seen how physical inactivity is very, very prevalent, and it's more common in girls versus boys. This is again a lot of data and papers that we have published on causes and consequences. It's a no-brainer. It's all listed. But what I'm going to highlight mainly is the built environment and physical inactivity or sedentary activity or sedentary time. Now it comes to physical activity statistics. 80% of adolescents do not meet the recommended levels. What's the recommended levels for children and adolescents? I'm asking you all. What is the recommended level for children and adolescents? Any idea for physical activity? 60 minutes. So as a researcher, as a clinician, we should know what is that recommended activity first, and that's 60 minutes for children. 1 hour a day a child should be able to play, right? You would think so, but they're not. So that's the problem. And when you look at adolescents, again, I'll keep coming back to why I'm talking about the boy-girl difference, because it's very, very apparent, and even in that, the girls are doing less than the boys. This is again from our data. You know, all our schools supposedly have PT class. What happens to the PT class? It goes on the moment the exams come or some other thing comes, the PT class is gone. Another thing is, when our further studies, I will show you something about school time and non-school time. We have actually put accelerometries in children and measured how much they really play. So this is, when we started doing all these studies, we had a global consortium which approached us to look at the physical activity and built environment in adolescents. And this is called the IPIN group, led by Professor Salis from UCSD. In this study, the first one is where we've seen how sedentary time and physical inactivity is related to BMI of these adolescent kids. And when we looked that up, the main driver of this obesity associations were actually non-school based MVPA. What is MVPA? Moderate to vigorous physical activity. So when you're saying non-school based MVPA is the biggest driver, what does it mean in simple English or in simple language? It means our children are not playing once they come home. We think we send our kids to school, they have a PT time and they're playing. I'll come to that story too. But the main thing is, once they come home, what are they doing? They're not playing. That 60 minutes should come. It's called leisure time physical activity. Leisure time is not happening in school. It has to happen at home. But that's not happening because with pressure and academic things and lots of stressors, of course, our kids don't play. So the intersection of built environment, physical activity and metabolic health is a triangulation that we have to start looking at. As ma'am marked in one of her slides, obesity is no longer as simple as when we studied in college, energy in, energy out. It is not at all that anymore. It's a very complex interplay of a lot of factors, and we'll be, even as clinicians, I know we may not have time, but when you're treating that child or you're looking at obesity or you're telling them, giving them advice, please have in mind what you're looking at. You have to look at their built environment, where they live, what are the shops close by, what's the family structure like, how many people at home, all that. There is a lot of those influences which play a very important role, and of course physical activity. There are these common jokes, a lot of memes come. Diabetes doesn't run in the family because you don't run. So it's, there are a lot of memes around it, people laugh, but then that's the fact. When the parents are not doing physical activity, you can't ask that child to get up and go. You're going to stock your cupboard with biscuits and then ask that child not to eat it. It's not happening. Okay, we Swiggy every day, but if that child is supposed to Swiggy weekly once, it's not happening. So it all starts with us, with people at home. If that has to come, that environment, that whole physical activity, this whole habit has to start from home. Only then we will see that change in health too. So with all this background, we started the study called the Be Active India study. And in this, we started with Chennai, with 324. This is a paper that we're looking at. This is the streets in Chennai, but of course it's streets everywhere, right? I just came from the airport, from Trivandrum, all narrow roads and people coming from all sides. In which footpath are we supposed to walk? Where there are encroachments, where there are dogs, or there is all kinds of rubbish there, or they are dug. Today they are there, the next day they are dug. Then you walk on the road, there is safety because we live in, we live in populous countries. So there are just vehicles everywhere. Vehicles are even on your pavements now. So where do we walk? We tell people go walk. Where do you walk? Where are the parks? Have you gone? There are very few now, of course, few urban. I come from Bangalore now, and yes, there are a lot of developments that happen there, but not every city is that blessed, right? The parks are, become sad shops. There will be people doing gambling there and things like that. So there are a lot of safety concerns there. So this kind of built environment is where, though as doctors or as clinicians or allied health workers, you might be just looking at patients, but if you have a voice to speak to the government, these are the places we should be speaking about. And why? Because through this study, we put accelerometry in these kids. Okay, so accelerometry is, we put them on a belt. They work on a triaxial axis. So you put them like on a belt. They wear it the whole day. They remove it only while taking bath. And this is done for 7 days. We give it to them for 7 days. So this is actual objective measurement of physical activity. You would think your child is playing. Look at how much they're playing. 30 minutes a day is overall what they play. That's overall. School time, non-school time, anytime, weekday, weekends, everything together. During school, we think they have a PT class and they're playing. Look at the time they're playing. The boys are doing 14 minutes, the girls are doing 7 minutes. And you will see a very typical change because we do actually school setting based studies. We go and we observe, we take surveys there, we look at, how the playground is, we do all this work. So when we see there, when you look at the lower, you look at childhood phase, say from a 10 to 13, they're still playing. The moment they start touching menak, there'll be a full distinction. The girls will be all huddled, they're always talking or they're doing something else. They're not running around. The boys will still be doing a bit of basketball or, depending on what facilities are around. But that running, there is sudden stop. Why is that happening? We need to question ourselves and we have to see what that social environment is causing that girl not to play. So this is I've just picked the top 5 perceptions of safety because when we did this, we had a very long subjective survey to understand the built environment and the issues around it. So in that we found out for girls, the biggest one comes is self-imposed. The moment they start growing older, it is the family members who will not tell them, after dark, you're not allowed to go out, right? Boys, they'll come because if they're finishing school at 4 o'clock, which most of the schools do nowadays, then you come home, you change, it's going to be dark by the time you get out to play. So if you're not allowed to do that, then what do you do, right? So that's one of the top first perceptions. And safety generally around roads, about lights, about how far the park is, whether the parents allow them out, all this also becomes an issue and it's a bigger issue for girls than boys. So we need to recognize these societal issues that we face and how we can, when we are advising whether it's a boy or girl, we need to work around this. And now coming to the most trending topic, which is screen time. So this is actually one of the first papers which associates personal social media use with physical inactivity and increased sedentary time. So this is a 14-country study and we were part of it. We represented India in this. This came early this year. Anjana and myself are the first authors in this. And this was a very complex analysis and a lot of complex data because you have high-income countries, you have middle-income countries, and you have low-income countries. And one thing, however, that was across the board is look at the sedentary time in adolescents. Globally, this is an issue. 7.8 to 10.5 hours is your sedentary time among adolescents, okay? Out of that, the one which actually stood out as the highest correlation for sedentary time across both sexes was personal social media use. What does that mean? If your child has an Instagram, has a YouTube thing, is doing something on that phone all the time or a Facebook, guaranteed higher amount of sedentary time, guaranteed higher physical inactivity. So I'm just going to break this study a little bit more. It's a very complex study across 14 countries. And this is from an Indian perspective that I put up in my slide, where obviously higher populous countries like China and India, so there's higher residential density. Do you think it's easy to walk when the residential density is higher? It's a little difficult. We don't have people, we have cows, we have all kinds of people, animals, dogs, cats, everyone with us. So where that brisk walking is not happening, you can walk just general, you can stroll around, which is what most people do. So aesthetics is another important app. So what we have found from the other high income countries is when you walk, you would like to see a nice painting, you would like to see some lights, there'll be some lights, a nice architecture. Those kind of areas people frequent more. This has come from previous studies. But when we looked at here, where are aesthetics in our countries? It's very rare. But nowadays, of course, with metro stations, you will see they're doing that effort. And all this is coming, these are policy-driven changes. This comes from the work that people, epidemiology do, and then we put it back to the government, and that's how all these aesthetics around stations and roads are coming across. Access to parks, obviously very poor in LMICs. Transit stop proximity is a junction, to reach a bus stand and think, how close? That's generally higher in populous countries because we need those bus stands and things like that. There's no pedestrian infrastructure, it's basically encroached. There are high traffic safety concerns. People just cross, it's, very difficult to walk on the road like that. And hence, we would think the sedentary time would be higher on weekends. Unfortunately not. It's the same as in weekday and weekends. Transport-related time, again in India, it is there because we travel quite a bit, but among children, it's generally lesser compared to the higher countries. As I said, the highest positive correlation was with personal social media use, and electronic device use was seen to be more common in boys than girls. So if you want to do some policy changes to reduce this adolescent obesity, the inactivity in India, you need to do physical education, you need to do community engagements where you have awareness campaigns, influencers who make a difference, okay, not just any Tom, Dick and Harry. So you have a type 1 with a lived experience talking about it, that makes a difference rather than somebody who has just done 3 weights and then, becomes an influencer and says, oh, now you have to do all this. That doesn't happen. Sports people are great, especially athletes are great influencers when you want to motivate physical activity. But the problem with thing is, we are very, film crazy people. So you need some, good fit film stars to push that child to do it. And this we are doing from practical experience, I'm telling you. Urban planning is you promote walking, cycling to school with safe paths, and you need to have car-free days, create parks and facilities, and you need to also encourage your girls at any situation, any setting. Please see that your girls are being included in everything, and you revive traditional games to foster interest. I'll take 2 minutes more because I just want to speak a bit on what we have done to combat this, and that's Tandav. And Tandav is happening today evening in the women's session because I'll be getting this to you all. And we specifically came up with this concept because we realized that girls are not being active enough. So what we did in Tandav is we combined 2 concepts, that is dance, which every woman or a girl likes to do and nobody stops them from doing it. You can do it on the road, in a wedding, nobody stops you from doing all that. But high intensity interval training is the new kid on the block. So we merged both together, and it's like aggressive dancing, but at the same time it's dancing, it's not Zumba. And the main thing about it, it's for 10 minutes because this is all feedback we got from qualitative studies that we have done in the field. And most women and girls say we want something to do at home, it has to be fun, it has to be less time, no clothes ka pabandi, no things of I have to wear this shoe, so all this together we came up with it. And we realized it works on all aspects, and we already have published data on this. This initial pilot study where we set Tandav was done on 23 adolescent kids, done with VO2 max and looked at their heart rates, and we found that its MET was quite high, which means it was a high intensity activity. And this is our latest paper on Tandav, where we actually looked at muscle mass and reducing fat mass and decreasing. See, they're adolescent kids, so obviously you're not going to get drastic weight loss, but we've seen the metabolic benefits of it. And more importantly, we didn't even study, but we've seen reversal in PCOS, we've seen menarche getting regularized, and these are the common issues that we see in girls. So Tandav is exclusive for women, so sorry boys and men, but you can join this, and it happens every Friday. So you can note that down and join us. Thank you.
Thank you so much, Dr. Ranjani, for sharing such useful and important insights. Of course, all of us are, need to learn that exercise and physical activity is something that we really need to put our focus on now. We will take the questions at the end. Sure. Thank you so much.